I am Dr. Jagannathan. Today I am going to discuss an overview of cholesterol because there has been a lot of misconceptions and myths about cholesterol, and cholesterol has been considered totally as a bad substance, but actually it is not true. Now, cholesterol is not totally a bad substance, but unfortunately, the name of cholesterol is always linked to heart attack, stroke, and other types of cardiovascular diseases. But our body needs cholesterol, which is a type of lipid that is needed for other constructive purposes like making cell membrane, making hormones like testosterone, estrogen, and bile, and needed to digest and absorb fat and also to create vitamin D. So, all these functions, important functions, are being carried out by cholesterol. Then, what is bad about cholesterol is cholesterol is not the substance itself. In fact, we can't live without cholesterol. But we think cholesterol is a bad substance. We have to avoid it completely. But it is totally a misconception. You cannot live without cholesterol. But in certain types of cholesterols, how much of them are in the bloodstream, it matters, because the quantity of the cholesterol matters what is going to be for the outcome of the cholesterol. If you have high cholesterol, making changes in your diet can help you to bring it down into healthy range, because a healthy range of cholesterol is essential for normal life. Exercise can help to boost the level of HDL. It's a type of cholesterol called the good cholesterol. Dietary changes and medications, notably the family of drugs known as statins, can powerfully lower the bad cholesterol called the LDL cholesterol. Now, we will going into the detail what is cholesterol. Cholesterol is a fatty substance that occurs naturally in the body. It performs several vital functions. It is needed to make the walls of the cell surrounding the body, and it is the basic material that is converted into certain important hormones. Our body makes all the cholesterol we need. We need only a small amount of fat in our diet to make enough cholesterol to stay healthy. The fat and cholesterol we eat are absorbed in the intestine and transported to the liver. The liver converts the fat into cholesterol and releases the cholesterol into the bloodstream. There are how many types of cholesterol? There are several types, but there are two main types of cholesterol. One is called the LDL cholesterol, or low density lipoprotein, and which is commonly known as the bad cholesterol. And number two is the high density lipoprotein, otherwise called HDL cholesterol, which is commonly known as a good cholesterol. High levels of LDL cholesterol are linked to atherosclerosis, that is hardening and narrowing of the arteries, which is the accumulation of cholesterol rich fatty deposits in the arteries. So, the cholesterol is deposited inside the arteries. This can cause the arteries to narrow and become blocked, sometimes or slowing blood flow and sometimes stopping the flow of blood to vital organs, especially the heart and the brain. Atherosclerosis affecting the heart is called coronary artery disease, and it can cause heart attack. When atherosclerosis blocks arteries that supply the blood to the brain, it can cause a stroke, brain stroke. People with high levels of HDL cholesterol are less likely to develop cardiovascular disease because HDL is a good cholesterol. However, if a person has both high HDL and high LDL cholesterol level, he or she might still need treatment to lower the LDL levels. Even though the HDL can oppose the actions of the LDL, when both of them are, especially when the higher level of LDL is present, you need other measures to bring down LDL levels. The desirable level of LDL cholesterol depends on whether or not a person already has a disease caused by atherosclerosis or diabetes or other risk factors for coronary artery disease. In addition to a high LDL cholesterol, the level and diabetic risk factors for coronary artery disease include lot of things. So the LDL cholesterol is higher, hypertension is there, diabetes is there, and there are other factors which can also influence that. So a person being a male older than 55 years, all the male above 55 years are eligible or liable to be affected by the influence of LDL cholesterol. Being a female older than 55 years, this applies only to women of age of 55 years. Being a female with premature menopause, having a family history of premature coronary artery disease, that is, a father, brother younger than 55 years with coronary artery disease, or a mother or sister younger than 65 years of age. Cigarette smoking is another factor which will influence the level of LDL cholesterol causing the heart disease. Having a high blood pressure, I already told you, an increased blood pressure can adversely affect can enhance the bad effects of LDL cholesterol. And lastly, not having enough good cholesterol, HDL. When the HDL levels are low and the levels of the LDL will be bad, and the person is liable to go for a coronary artery heart disease or a brain stroke or other vascular diseases. Now, having understood the effects about HDL and LDL cholesterol, now what is the normal cholesterol levels? See, I have already told you that cholesterol is essential for life. Without cholesterol, you cannot live. But there is a normal range. The total blood cholesterol level is determined by the LDL and HDL values and also the levels of another substance called triglyceride. So the triglyceride is also another important part of the cholesterol family. Instead of looking at a table, you and your doctor should decide what personal goal numbers you should strive for. So we should aim at a number which we should not cross that. So the ideal cholesterol level is less than 70 milligrams per deciliter if you have coronary artery disease, peripheral vascular disease, and have a stroke or atherosclerosis would be your goal. So if you have all these problems, you already have a stroke, already heart disease, already peripheral vascular disease, your goal should be LDL should be 70 milligrams. And however, if you do not have the cardiovascular disease or there is no risk factors for it, LDL cholesterol level can be 100 to 130 milligrams per DL. It is acceptable. So if you are a normal person, 100 to 130 milligrams of cholesterol, LDL is acceptable. If your levels of HDL cholesterol also matters, that's also important. People with the levels of below 40 milligram HDL cholesterol are more likely to develop atherosclerosis and stroke. So the levels of HDL cholesterol should always be more than 40 milligrams. In general, triglyceride levels under 150 milligram is a good goal. So LDL in normal people 100 to 130, HDL more than 40, and triglyceride 150. If you have risk factors, the LDL level should be around 70 milligrams. Now, will the high cholesterol cause any symptoms? most people with high cholesterol don't have any symptoms until cholesterol related atherosclerosis causes significant narrowing of the arteries leading to the heart or brain. So, unless you have a end organ damage, you won't know your cholesterol is high. Just simply the increase in cholesterol that does not produce any symptoms. The result can be heart-related chest pain. So high cholesterol can cause heart-related chest pain called angina or other symptoms of coronary artery diseases, as well as symptoms of decreased blood flow to the brain, the transient ischemic attack or a stroke. So these are all the symptoms, these are all the things that can happen when you have a high cholesterol levels. But this, unless these symptoms are there, we will not recognize that we have got a high cholesterol level. About 1 out of every 500 people has an inherited disorder called familial hypercholesterolemia. Familial hypercholesterolemia, which can cause extremely high cholesterol levels, above 300 milligrams per deciliter. See that hypercholesterolemia is a inheritance. It is a congenital disease. Comes in families. People with this disorder can develop nodules filled with cholesterol. This is called xanthomas over the various tendons, especially Achilles tendon and the lower leg. In the lower leg, we may have the cholesterol deposits like some nodules. Cholesterol deposits can also occur in the eyelids, where they are called xanthomas. So, in familial hypercholesterolemia, we can find out these symptoms. Now, to control or to avert increase in cholesterol levels, what is the best diet to lower cholesterol level? There is no consensus on the best diet. We cannot say this is the best diet, this is a not best diet. The most effective diet to lower the total and LDL cholesterol is vegetarian diet. Vegetarian diet is definitely the best diet for lowering cholesterol. However, this is not an easy diet to follow, isn't it? Of course, for people like us in India, it's easy. But in the Westerners who are dependent mostly on non-vegetarian diet, it's very difficult for them. Then, how we can modify our diet, getting the majority of daily food calories from plant sources. See, our main source of calories should come plant source. That is non-vegetarian diet, especially fruits, vegetables, grains, beans, nuts and seeds. Then using olive oil as the principal fat, replacing other fats and oils. We are using a lot of oils, vegetable oils, we are using coconut oil, we are using groundnut oil, we are using vanaspati, we are using trans fats, all these things. We have to avoid all these things. So the best thing is using olive oil. Having some low fat cheese and or yogurt daily. You can have yogurt daily. Eating fish at least a couple of times per week, because fish does not have is not rich in cholesterol, because it has a lot of omega-3 fatty acids also. Limiting the processed foods. The fast foods and processed foods, they contain lot of trans fats, so you have to avoid them. Drinking alcohol in moderation. So alcohol moderation is essential. To maintain a desirable weight, you have to maintain your weight at a desirable level. Never to exceed your BMI. Your body mass index should not exceed the permitted levels. If you need to lose weight, you need to take a fewer calories than you burn. That means you have to reduce the diet. You have to moderate your diet. You have to restrict your diet. People who are not sure how to follow such a diet may find it useful to work with a healthcare professional or a dietitian. You may, if necessary, you can consult a dietitian, a nutritionist, a doctor, a nurse, or a professional help can be taken. Now coming to the treatment, how to diagnose? Because diagnosing the hypercholesterolemia is making a blood test. A blood lipid profile will, when you subject your blood for lipid profile examination, you will find out what are the levels of each LDL, HDL, triglycerides and all these things. So now having diagnosed, you have got hypercholesterolemia, your cholesterol is high, what are the drugs treatment for high cholesterol. Whether you need a medication to lower your cholesterol level depends upon how you respond to diet and your personal risk of heart attack and stroke. So, first thing is you follow your lifestyle modification. You restrict your diet, you increase your exercise, you reduce your weight, stop smoking, and limit alcohol. All these things are lifestyle changes. With all these lifestyle changes, if you could control or achieve an expected level of cholesterol control, then you need not go for a drug. But if you cannot achieve this with the lifestyle modification, you have to go for drugs. There are 5 types of cholesterol lowering medications. However, a statin should always be the first choice to lower LDL cholesterol. So, statins are the primary drugs for lowering LDL cholesterol. Statins are called, they reduce the LDL level. They include, there are a lot of statins. The common statins are lovastatin, atorvastatin, rosuvastatin. We need not go into details of all these things. Most of us know atorvastatin, rosuvastatin, lovastatin. Statins block an enzyme, reductase enzyme, which is necessary for the production of cholesterol. So when you take statins, they prevent the production of cholesterol. So statin do much more than lower LDL cholesterol number, because they lower the risk of developing hardening atherosclerosis, the hardening of arteries. I told you, isn't it? The cholesterol gets deposited in the arteries, and the arteries become harder, stiffer, narrower, and ultimately blocked. So the statins reduce the chances of atherosclerosis also, and you will have and thereby statins prevent you from having a heart attack or a stroke. When a person taking a statin does not reach a goal, sometimes we have to add another drug called estimabine. Estimabine inhibits absorption of cholesterol from the intestine. Estimab by itself, the brain, when combined with simvastatin, it is called Vytorin. These are the names of the trade names. Now we need not go into the detail. Cholesterol lowering therapies called PCSK9 inhibitors are more potent drugs. These are another group of drugs, and these drugs are given by injection. We need not go into more detail into that. People with coronary artery disease who either don't reach the goal with a high dose of statin or cannot tolerate statin because of side effects may also be candidates for this new therapy. I told you this PCSK9, isn't it? So this is applicable only to people who don't tolerate statins. The most common type of drug prescribed for high level cholesterol, another good high level of triglycerides. Now we are not talked much about triglyceride. Triglycerides are controlled with fibrates, the fenofibrates that include gemfibrozil, fenofibrate, and clofibrate. These are the drugs which are used to reduce the triglyceride. And another one is omega fatty acids. Omega fatty acids, the Lovasa, for people with high levels of triglyceride levels, people with even moderate elevated triglyceride levels, and increased risk of cardiovascular disease may benefit with the omega fatty acids. The one thing which I want to emphasize, omega fatty acids are not equal to statins. Statins are definitely drugs which all definitely bring down the LDL levels. But omega fatty acids, they facilitate the lowering of the triglycerides. So the continuation of taking triglycerides depends upon the advice of your medical professional. As per the doctor's advice, you can continue omega-3 fatty acids, and if necessary, you can leave it for some time, and necessary, you can continue with that. So, this is a short overview of cholesterol, and going in detail into each type of cholesterol, it will take some more time, and that we will discuss in another situation. Thank you very much for listening to this discussion, Dr. Jagannathan.